Welcome to the deep dive. Today we're tackling a condition called angiodysplasia.
hmm
Now that might sound a bit technical, but it's really about understanding these, well, sometimes hidden, fragile blood vessels in your gut.
That's right. They can cause some, surprising issues, especially as people get older.
Yeah, and we've got a great set of revision notes here covering really all the key aspects.
We do. So our mission today is to sort of pull out the crucial bits, break down the jargon, and hopefully give you some useful memory aids to make it all stick.
Perfect. A shortcut to really getting a handle on angiodysplasia.
Exactly.
Okay, let's dive straight in then. In simple terms, what exactly is angiodysplasia?
Okay, so angiodysplasia is essentially abnormal, fragile blood vessels. Think of it like a vascular deformity, a bit of a weakness in the structure.
Okay.
And it's most often found in the gastrointestinal tract, frequently in the colon.
Right, so not your standard strong blood vessels.
Sure.
What problems can these sort of fragile ones cause?
Well, the main worry is bleeding, an increased risk of bleeding. And over time, that can lead to things like iron-deficiency anemia.
Okay, the anemia connection.
Yeah. And there's also this interesting point of discussion in medical circles, a potential link with aortic stenosis, the heart valve condition.
Really? Between the gut and the heart valve?
It's debated, still being researched, but it's out there as a possible association.
Fascinating. And you mentioned age earlier. Who mainly gets this?
It's definitely more common in elderly individuals.
Right. Makes sense. Things get a bit more worn over time. So what actually causes these vessels to become abnormal? What's the etiology?
Well, that's the thing. The exact cause isn't fully understood. We often say it has an unclear etiology.
Okay.
But contributing factors seem to be age-related degenerative changes, just wear and tear on the blood vessels over time.
So getting older is a big part of it.
It seems so. And increased blood vessel fragility that comes with that.
Are there other specific things like risk factors that make someone more likely to develop it?
Yes, definitely. We've already hit on advanced stage. Chronic kidney disease is another important one.
Kidney disease, right?
And also von Willebrand disease. That's an inherited bleeding disorder.
Von Willebrand.
Okay.
So age, kidneys, and this specific bleeding disorder. Got it.
Those are the key ones to remember.
Okay. Let's get a bit more into the weeds. What's actually happening inside these blood vessels? The pathophysiology.
So at the sort of microscopic level, you see dilation, the vessels widen, and they become tortuous, meaning twisted.
Widened and twisted.
It sounds unstable.
Exactly. That happens in the mucosa, the lining of the GI tract. And the consequence is you get these fragile vascular lesions.
Which are prone to bleeding.
Precisely. You could almost picture maybe like old garden hoses,
Yeah.
ones that bulge and get weak spots.
Yeah, that's a good visual. Okay, so if someone comes in with GI bleeding, it's not automatically angiodysplasia, right? What else could it be? What's the differential diagnosis?
That's a really crucial point. Several things can look similar. We need to think about diverticulosis, those little pouches in the colon.
Right. Colorectal cancer, obviously. Inflammatory bowel disease like Crohn's or ulcerative colitis, and other types of vascular issues like arteriovenous malformations or AVMs.
So quite a list to work through for the doctors.
Absolutely. Careful differentiation is key.
And how common is this condition? Thinking about the epidemiology, say, here in the UK.
Well, the prevalence definitely increases with age. We see it much more often in individuals over 60.
So it's something that pops up more as the population gets older.
Exactly. It's quite common in that demographic.
Okay. Now, what signs or symptoms might actually make someone think, maybe this is what's going on? What are the clinical features?
The classic presentation is usually intermittent, painless bleeding.
Intermittent and painless. Okay.
Yeah, so it's not always constant. It might come and go. And how it shows up can vary. It could be bright red blood in the stool.
Which suggests lower GI bleeding.
Generally, yes. Or it could be melena, those black tarry stools.
Which means the blood's come from higher up and been digested a bit.
That's right. Upper GI bleeding typically causes melena.
So any kind of unexpected blood like that, bright red or black, is definitely a sign to get checked out.
Absolutely. It signals some kind of GI bleeding, and finding the underlying cause is important. It could certainly be angiodysplasia.
Right, so someone has these symptoms, they go to the doctor. What investigations happen next to figure things out?
The main tools are endoscopic procedures. We need to actually see inside the GI tract.
Okay. Cameras.
Exactly.
Hmm.
For lower GI bleeding suspicions, a colonoscopy is the usual first step.
Right, looking at the colon and rectum.
Yeah, it lets us directly visualize the lining, find the bleeding source, or spot those typical angiodysplasia lesions. They often look like little red spiders or ferns.
Okay, and if the bleeding seems to be coming from higher up.
Then we'd go for an OGD, that's an esophagastroduodenoscopy. Same principle, flexible camera, but looking at the esophagus, stomach, and the first part of the small intestine, the duodenum.
Got it. So OGD for upper, colonoscopy for lower. What if someone is bleeding quite heavily, like an acute bleed?
Yeah, if there's significant active bleeding, sometimes the standard scopes might struggle to pinpoint the exact spot. In those cases, we might use mesenteric angiography.
Angiography. That sounds more specialized.
It is. It's usually done by interventional radiologists. They use contrast dye injected into the arteries, supplying the intestines to visualize the blood vessels.
Ah, so they can see the leak, as it were.
Exactly. It helps pinpoint the source in acute bleeds and sometimes allows for treatment right then and there, like embolization to block the bleeding vessel.
Okay, that makes sense for urgent situations.
Mm.
So let's say angiodysplasia is diagnosed. How is it managed? What are the treatments?
The main goal is to stop the bleeding and prevent it from happening again. Usually the first line is endoscopic treatment.
Going back in with the scope.
Yes. We can use techniques like thermal coagulation using heat or argon plasma coagulation, which uses ionized argon gas to essentially seal off those fragile bleeding vessels.
Like cauterizing them, sort of patching them up from the inside.
Precisely. That's a good way to think of it.
And what if that doesn't work? Or the bleeding is really severe?
Then surgery might be considered. That usually involves removing the section of bowel where the lesions are, but that's generally reserved for more difficult cases.
Okay. Are there medications, too?
Yes, there are some pharmacological options. Antifibrinolytics like tranexamic acid can be used. They help stabilize blood clots.
Tranexamic acid, okay.
And interestingly, estrogens have sometimes been used, though the evidence is a bit mixed. And how they work isn't entirely clear in this context. It's maybe a less common option.
Right. So endoscopy first, maybe meds, surgery if needed. What's the general outlook, the prognosis?
Generally, it's quite favorable. Most cases respond well to treatment.
That's good to hear.
Yeah, the bleeding can usually be controlled, and the aim is to manage it long-term to prevent recurrences.
But are there potential downsides? Complications?
The main ones are what you might expect. Recurrent bleeding episodes.
Right, it coming back.
Yes, and chronic anemia because of that ongoing or recurrent blood loss.
Makes sense.
And then, much more rarely, you can get a really severe gastrointestinal hemorrhage. That's a medical emergency, might need blood transfusions, urgent intervention, possibly surgery.
Okay, so mostly manageable, but potential for serious issues if not controlled.
Exactly.
All right, this has been super clear. Now, to help everyone listening remember all this, let's run through those memory aids you mentioned, starting with the definition.
Okay, for the definition, think abnormal dilated vessels causing bleeding. So maybe remember bad vessels.
Bad vessels. I like it. Okay, let's try an example question.
Yeah.
An elderly patient presents with unexplained iron-deficiency anemia. What common vascular abnormality often found in the colon should be considered?
That would be angiodysplasia, remembering those bad vessels.
Perfect. How about risk factors?
Key ones are age and kidneys, chronic kidney disease. For von Willebrand disease, maybe think VWF, vulnerable vessels, fallible.
Vulnerable vessels, fallible.
Nice.
Okay, question. Besides advanced age, what chronic medical condition and inherited bleeding disorder are notable risk factors for angiodysplasia?
That's chronic kidney disease and von Willebrand disease.
Great. Pathophysiology, what's happening to the vessels? You had that image.
Yeah, think of twisted hoses leaking, dilation and tortuosity making them fragile.
Good visual. So, question. Describe the underlying vascular changes that characterize angiodysplasia.
That would be dilation and tortuosity of blood vessels in the gastrointestinal mucosa, forming fragile, bleed-prone lesions.
Excellent. Differential diagnosis, what else could it be?
For the differentials, try the mnemonic DICA.
DICA.
DICA. Diverticulosis, IBD, inflammatory bowel disease, cancer, colorectal, AV malformations.
DICA. Got it. Question. Name 3 other gastrointestinal conditions that might present with similar bleeding patterns to angiodysplasia.
Using DICA, you could name diverticulosis, inflammatory bowel disease, and colorectal cancer.
Perfect. Investigations, how do we find it?
Think, see the source. Colonoscopy and OGD let you directly visualize. And for really bad acute bleeds, think angiography for angry bleeds.
See the source, angry angiography. Love it.
Uh,
Okay, question. What are the primary endoscopic investigations used to diagnose angiodysplasia, and in what circumstances might mesenteric angiography be considered?
Primary are colonoscopy and OGD. Mesenteric angiography is for acute, severe, or difficult to locate bleeding.
Fantastic. Management, how do we treat it?
Think. Seal the vessels endoscopically, cut with surgery if needed, stop the bleeding with antifibrinolytics, and maybe hormones like estrogens, though less common. Seal, cut, stop. Hormones.
Seal, cut, stop, hormones.
Mhm.
Okay. Question. Outline the main approaches to managing bleeding from angiodysplasia.
Endoscopic coagulation, seal. Surgical resection, cut. Antifibrinolytics like tranexamic acid, stop. And potentially estrogens, hormones.
Brilliant. And finally, complications.
For complications, think breakdown. B for bleeding recurrent, RA for anemia, and the key reminds you it can rarely break down into severe hemorrhage.
Breakdown. Simple. Question. What are the two most common complications associated with angiodysplasia?
That's recurrent bleeding and anemia.
Fantastic. Those mnemonics and questions are really helpful. Hopefully that makes things stick for everyone.
Hope so.
So just to quickly recap the main takeaways from our deep dive today on angiodysplasia.
Sure. It's basically about fragile, abnormal blood vessels in the gut, mostly the colon. They tend to affect older people and can cause painless intermittent bleeding, leading to anemia. Diagnosis relies heavily on endoscopy, seeing inside with cameras like colonoscopy or OGD.
Right.
And management focuses on stopping the bleed, often with endoscopic sealing techniques, though meds and sometimes surgery have a role. The outlook's generally good, but recurrent bleeding is the main thing to watch for.
Excellent summary. It's definitely a condition worth knowing about, especially when thinking about GI bleeding in older adults.
Absolutely.
Well, that brings us to the end of this deep dive. As always, keep exploring, keep learning, and for more fantastic revision resources, do check out PassTheMSRA.com.
And also freemsra.com for more great content.
Thanks for joining us.